My name is Elizabeth Duncan, and this is my video on healthcare options for College for America. Let's first talk for just a moment about what healthcare is. It is the maintenance and improvement of a person's physical and mental health through the use of medical services. There are very many career paths that you can take in healthcare. While there are the well-known paths such as doctors, nurses, and specialists, there are many others that have varying degrees of training and education. I'd like to share some of those with you today. Let's talk about those that have patient interaction first. Some of those that come to mind for me are doctors, which are your PCPs, which is your primary care physician, and specialists. Nurses, which include RNs and LPNs, nurses' aides, specialized nursing that works in specific fields such as cardiology, physical and occupational therapists, surgeons, and there are many different types of specialty surgeons, psychologists, phlebotomists that draw blood, and then there are other varying positions that are really behind the scenes. So if you are interested in working in the healthcare field, but not necessarily directly with patients, there are many options there as well. So some of the behind the scenes positions would be healthcare documentation specialists, laboratory positions, medical secretaries, healthcare administrators, or possibly medical records clerks. Let's talk for a few moments about the non-clinical healthcare roles. I'm going to provide you examples of 3 and let you know what the education and skills that are needed for each of those 3 are. First, there is the medical transcriptionist. The education. They will need a knowledge of medical terminology and the language and the writing skills to transfer abbreviated and basically simplify note-taking into usable information for medical files. Many of these degrees are achieved through attending community colleges, and it's really an associate's degree in medical transcription. Some of the skills that you would need for this role include good listening skills, typing accuracy and speed, computer literacy, and multitasking skills. Let me share another. Healthcare administrators. For this role, you would need a master's degree in healthcare administration. And from a skills perspective, candidates should understand finance, business organization, law, and ethics as they relate in a healthcare setting. Finally, let me share the third, health information management. From an education perspective, you would need a health information management degree, which is typically a bachelor's degree in that field. And the types of skills that you would need would be the knowledge of medical terminology, medical law, and medical coding systems, and to be able to interact well with people. Now let's move into some other careers associated with the healthcare field. These are allied health positions. The allied health profession is part of the healthcare field that provides services related to the identification, evaluation, and prevention of diseases and disorders. This is a growing field that is estimated to grow by 4 million in this field between 2010 and 2020. Let me provide you 6 different allied health professions in that field. The first would be dietetics. Dietitians are the professionals that have the knowledge of how diet impacts your health. They work to improve patient health by creating diet plans based on patient conditions. Dietitians can work in hospitals, nursing homes, and long-term care facilities, just to name a few settings. Next, let me share the next degree, which would be an optician. This position fits patients for eyeglasses and contacts following the prescription written by the optometrist or the ophthalmologist. Next, let's talk about respiratory therapy. A respiratory therapist is a person who helps people with chronic respiratory diseases like asthma and bronchitis. They work with patients to develop care plans and recommend disease management programs to improve their respiratory function and work under the guidance of a doctor. Next, let me share radiological technologist. This is the person that performs the diagnostic imaging procedures such as MRIs, CT scans, and X-rays. They must ensure the patient is positioned at the right angle for the right quality images. They work very closely with radiologists. Next, let me share another profession within the allied health profession, healthcare documentation specialists. This is also known as a medical transcriptionist or medical documentation editor. This allied health career listens to voice recordings of the physician or health professional and either transcribes the information into an electronic record or reviews and edits a version produced by software for the record. Last of the 6 is nuclear medicine technology. This profession looks at how body functions in order to help the diagnosis and treatment of various conditions and diseases. Nuclear medicine combines imaging, patient care, chemistry, physics, math, computer technology, and medicine. Next, let's talk about RNs, LPNs, and nurse practitioners. To become an RN, you would require a Bachelor of Science in Nursing, and the typical job responsibilities include assessing patient conditions, recording patient medical history and symptoms, observing and recording observations, administering meds and treatment, setting up patient care plans, contributing to the existing plan in place, consulting and collaborating with doctors and other health professionals, operate and monitor medical equipment, help perform diagnostic tests and analyze the results, and teach patients and family members how to manage an illness or injury once they leave the facility. Next, let's talk about the LPN profession. They would need to complete an approved program that typically takes approximately 1 year. This program is a variety of technical schools, community colleges, and sometimes even offered through high schools and hospitals. Next, they will want to take the test to gain their license through the National Council Licensure Examination, and this is specific to their state. So their typical job responsibilities would be to monitor patient health, like taking their blood pressure or their temperature. They can administer patient care, such as helping with bandages, help with bathing, dressing, and feeding. They can also insert catheters and collect samples for routine lab work. They report any issues to the RN. Last is the nurse practitioner, also known as an APRN, which is an advanced practice registered nurse. The education for this is a Bachelor of Science in Nursing. Also, a master's degree is the most common form of entry-level education, and they may choose to earn a doctorate of nursing. Most states recognize all of the APRN roles. In some states that recognize some of the roles, APRNs must have a registered nursing license, complete an accredited graduate level program, and pass a national certification exam. Each state's Board of Nursing can provide details on state-specific requirements. Typical job responsibilities for a nurse practitioner or APRN include everything that the RN does, but they also have some additional responsibilities. They can do physical examinations, prescribe medication, diagnose various health problems, and analyze tests and alter treatment as a result of their analyzation. That is all I have for you today on the various healthcare opportunities on both the behind the scenes and in front of the scenes with patients in the healthcare field. Thank you.